When I got diagnosed with rheumatoid arthritis, the subcutaneous injectable that I got placed on was a drug that I was educating on, but it also came with a lot of side effects. My side effect was the most common, which was severe fatigue. So I knew for 24 to 36 hours, I was going to have severe fatigue, and it was clockwork. I'm a person that's always on the go. I'm a multitasker. I have a to-do list either written down or in my head. What's my next task? What's my next task? The fact that I couldn't complete those tasks because my body couldn't keep up with my mind telling me what to do was, I think, my hardest thing to accept with my RA. And the fact that now cannabis has given me the opportunity to not have to do that, I can't tell you the peace that it gives me. I'm Razia Qureshi-Shalami, and I use cannabis for my chronic rheumatoid arthritis. I actually am born and bred in Denton, Texas. I come from a healthcare background, and I've been using cannabis for the past 4 years. Some of the things that really got me venturing into the cannabis space was my diagnosis of chronic rheumatoid arthritis. I got diagnosed young, 21, 22-year-old. People think, oh, arthritis, old age. You get arthritis when you're older, or, oh, you have a bad knee, that's arthritis. Rheumatoid arthritis is an immunosuppressed condition. It's actually linked into your immune system. It is in the same category as lupus, as fibromyalgia, as Crohn's disease, as ulcerative colitis. And the unfortunate thing is there is no rhyme or reason of why it can present in somebody's body, as it did with mine. Something awoke. When I was 21, 22 years old, I went to bed like I usually do. I woke up to go brush my teeth in the morning, and I had severe stiffness in my body. And the only thing that presented at the time was my left hand, my left knuckle, middle finger was swollen. Other than that, I didn't really know what was going on. I was an avid runner in college, basketball player, and all of a sudden I was like, what's happening here? I made my way over to the restroom by holding the walls, holding things, going really slow. And then I ended up going to the emergency room. Well, fast forward 16 years of taking a really hardcore drug, methotrexate. In combination with the injectable I was taking, it was a good therapy. But ultimately, when I found myself needing and wanting to get off of the drugs because I was trying for a baby, and methotrexate is considered a category X. It is deadly to a fetus. So I was told that you will need to be off of this drug 9 to 12 months. That kind of hit me. It made me stop and think, wow, what kind of drug am I putting in that it is literally deadly to a fetus? And I saw a story about a local cop in Tarrant County who was teaching about CBD oils for individuals and friends on the force who were suffering with pain, sleep, stress issues. And I was struggling being in the hospitals and visiting doctors with my pain and coming home with my feet hurting and my hands hurting and trying to take care of this baby. Well, 2 months post-delivery, I had a crazy flare, which all the doctors, they told me this is what's gonna happen because I was off my medication. I was pumped with morphine for 14 hours in the emergency room. Everybody said, get back on the medication. I didn't want to. And so I happened to see that news story. The next day, I called around local places and we found a shop. I started with a sublingual oil, and day 13, I went off that drug. And I have never touched that drug in now nearly 4 years. And it's amazing. I'm not on any pain pills. I didn't know that was possible. My wellness cannabis routine is daily. I do a combination of an oil that I put under my tongue, and I hold it there as long as possible. We say up to 2 minutes, and I swallow. And the reason why I do that is because of the most sensitive receptors in the human body. It is a live resin oil. It's THC in the morning, full spectrum live resin. It doesn't get you high. I think there's a big misconception there. There's a big stigma. THC means you must get high. No, I'm fully functional. I also take a wellness gummy, which is infused with cannabigerol. CBG is one of the most studied to date for anti-inflammatory, pain relief properties. That particular cannabinoid has been very effective for someone like me with rheumatoid arthritis, for others that I know of that have ulcerative colitis, Crohn's, fibromyalgia, MS, whatever it may be, because ultimately we deal with a lot of inflammation. Coming from a Pakistani heritage, this is not something you do. This is not something you take. And what would people think of it? And how would my family accept it? And I feel like a lot of people can relate to feeling that way within either their culture or society as a whole. So I'm just really excited to be at a place where I can advocate for knowing your source and empowering yourself to the best of your ability to improve your quality of life. And that's literally what cannabis has done for me without initiating any type of side effects. If I go back to when I had that nasty flare and I was in the hospital, and I never saw the DA coming down hard on the ex-cop, I would have got back on my medication. I don't know if I would have had my second baby, because for family planning, I would have to be off of it 9 to 12 months. I didn't want to do that. How many years was my liver going to be okay? Or would I get so accustomed to certain medication that it would stop working? My story is that I was like, wow, I'm not in pain. I'm not gonna take this pain pill today. I didn't take the pain pill. And I did well. Day 1, I did well. Day 2, I did well. Day 3, and then I said, oh, I don't need those anymore. It is my plant medicine. It is what doesn't initiate any other side effects, and it helps me keep my symptoms at bay. It's not perfect. It's not a cure, but I'll take that any day than going and getting my liver function tested every 3 months. I used to not be able to open this because my dexterity control was lost in my hands. So I was passing it on to my spouse or a loved one or even a perfect stranger. Say, hey, could you open this for me? The second that I knew that I could open it, man, you couldn't take the grin off my face. I think about the moment I walked into the very first CBD store with a little baby in a stroller, and I said, is this okay to do? I was worried I had such a stigma, and I thought I was gonna walk into a place full of smoke. Am I gonna be filling my baby's lungs with all of this? Am I being a good mother? And I was so pleasantly surprised with that experience. It empowered me to continue on my journey, and I'm so glad I did.
Learn more about cannabis and begin your medical cannabis journey at leafwell.com.